Hello. This article was published by Ellen Chioca from Chicago. Epiglottitis. 4-year-old Pedro Chapa arrives in the pediatric outpatient clinic with his mother. Through an interpreter, Mrs. Chapa says that Pedro was fine until this morning when he developed a fever and sore throat. Now his throat is so sore that he can't swallow, so he's drooling into a tissue. When you ask him how he feels, he can't answer. Pale and anxious, he appears to be focused on breathing. His vital signs are BP 102/66, temperature 103.2 degrees Fahrenheit or 39.5 degrees Celsius, pulse 128, respirations 32 and labored, SpO2 92%. You notice suprasternal retractions and nasal flaring, but no cough. What's the situation? Mrs. Chapa says none of her other 3 children are ill. The family recently moved to the United States from rural Mexico, and the children haven't had any routine immunizations. Pedro has no significant medical history. As Mrs. Chapa speaks to you, Pedro becomes agitated and begins to cry for her. His voice sounds muffled. What's your assessment? Based on the clinical picture, you suspect that Pedro has epiglottitis. Most common in children ages 2 to 5, epiglottitis typically is caused by the bacterium Haemophilus influenza type B, also known as HIB. Because most children born in the United States are immunized against HIB, epiglottitis is no longer common. Signs and symptoms of epiglottitis include sudden onset of a high fever, difficulty breathing, severe sore throat, drooling, and muffled voice. To ease breathing, the child may sit in the tripod position, upright with his mouth open, jaw thrust forward, and tongue hanging out. In comparison, croup, a viral respiratory infection, is characterized by a barky cough and low-grade fever that usually develops slowly after an upper respiratory infection. The child may be hoarse, but can still talk and swallow. Definitive diagnosis of epiglottitis is made by direct inspection of the epiglottis, which will be cherry red. But don't try to inspect the epiglottis unless staff is prepared to intubate immediately. Inspection can trigger laryngospasm, airway obstruction, and respiratory arrest. Without prompt treatment, Pedro is at risk for complete airway obstruction and death. What must you do immediately? Have a back valve mask device and supplemental oxygen ready in case Pedro's respiratory status deteriorates. Stay with him and ask a colleague to notify the clinic physician immediately. Call 911 and bring the pediatric crash cart. Make sure the cart has an appropriate size laryngoscope, endotracheal tube, cricothyrotomy tray, and pediatric tracheostomy tray in case Pedro's airway completely obstructs. Keep Pedro sitting up, with his mother nearby to hold him and keep him calm. Crying can increase airway swelling and precipitate obstruction. Administer blow-by oxygen at a rate of 10 liters per minute, unless this upsets him more. Place him on a cardiorespiratory monitor to continuously monitor his vital signs. Also note his color and oxygen saturation. Quickly auscultate his lung fields to assess for adequate ventilation. After the physician intubates Pedro, the child is transported to the nearest pediatric critical care facility for intensive care, mechanical ventilation, and IV antibiotic therapy. What should be done later? Pedro will remain intubated for 48 to 72 hours until the epiglottal swelling decreases. At this point, blood and throat cultures can be obtained to support the diagnosis and to make sure the right antibiotic has been prescribed. Pedro will continue to receive IV fluids, antibiotics, and sedatives. Epiglottal swelling should begin decreasing after 24 hours of antibiotic therapy, but Pedro will likely remain intubated for 3 days. He may receive corticosteroids 24 hours before extubation to decrease laryngeal swelling. After extubation and discharge, he'll complete a 10-day course of oral antibiotics at home. Pedro's brothers and sisters should receive immediate antibiotic prophylaxis. Because HIV can cause other serious illnesses, such as meningitis, Pedro and his siblings should be immunized against it.